my name is Dr. Jessica Arneson. I am a fellowship-trained surgeon with Aziz Foot and Ankle. Total ankle replacements are a new and innovative way of getting you back that range of motion that you used to have when you were younger. Ankle arthritis is a serious problem in many patients today, and there aren't a ton of options outside of an ankle fusion. Thankfully, there's new techniques, new surgical methods, and new companies that give you that range of motion back. A total ankle replacement is similar to a total knee or a total hip replacement in the way that we remove the previous joint that has severe arthritis and we go ahead and we replace it with a new metal implant. One thing about the total ankle implant that I like to use is it does have the option to have a CT guided implant, so that way we are using your patient anatomy specific to that individual to make the cuts for your ankle replacement. Also, they have a revision system, so if you ever do need a revision 15-20 years down the road, there are options. Typically, in conjunction with a total ankle replacement, we will also take some bone marrow aspiration to place on the implant to help it incorporate into the joint. We will also lengthen the calf muscle to make sure you have excellent range of motion when the procedure is complete. There are lots of good candidates for total ankle replacements. Most of them are patients who have significant osteoarthritis or rheumatoid arthritis. This allows them to get their range of motion back. With any foot and ankle procedure, I typically tell patients that they should expect at least 3 months before they're back up on their feet doing their normal activities. However, with a total ankle replacement, you are able to walk on it at 2 weeks postoperatively in a protective cam boot as long as the incision has healed. With any surgery, especially reconstructive hind foot and ankle surgery, there are risks. However, we take all of our precautions so that we can minimize those, especially in the operating room and postoperative. The results are extremely effective for total ankle replacements. You are looking for a pain-free joint and hopefully trying to get some new range of motion out of that. The goal would be to have a pain-free motion so that you can walk and get back to your normal activities. What made me want to specialize in total ankle replacements was the fact that I was an athlete growing up. I saw lots of ankle fractures, ankle sprains that led to really significant arthritis in patients and athletes. That being said, they lose their range of motion and they aren't able to do the activities they want anymore. Once that arthritis is there, we're able to replace the joint and hopefully get you back on your feet. What's important to me in my profession is a good balance between professionalism and nurturing and caring for our patients. My most important thing would be to have great patient outcomes, but also to connect with them.